We are living in turbulent times. My name is Mike Rosenberg. I'm a strategy professor at IESE Business School. We're broadcasting live from the IESE campus, which is pretty much empty. We have sent all the students home, and pretty much all the faculty and staff are also home. We have a skeleton crew working to do things like produce this video, and we're also teaching a few of the online sessions now from campus, although most of our professors are teaching from home. These are complicated times, and we know that many of our graduates and many of our friends around the world are dealing with these times. We know that many of you have positions of authority. We have people who will work for you, people who work with you, and they are asking you questions about what's going on and what to do. We know that many of your management committees, many of your companies are thinking through these issues. So we have been trying to help to the degree that we can from the business school with a series of webinars designed to give you information and to give you ideas about what to do. This is the third such webinar. We did one in New York City, one here in Barcelona last week, and we'll be doing a series of them, basically one a week for the next few weeks. Next week, we'll have Javier Santomá talking about the financial implications of this crisis. The Monday after that, we'll have Weiming Zhu, who was on part of the panel last week, talking about supply chain. We'll have Annaluz Royce on April 3rd. This is 2 weeks away, talking about the human resources implications of the crisis. And then we'll go back to economics with Nuria Mas, the chairman of our economics department, on Thursday, April 16th. After the entire cycle, we've arranged for me and Pedro Videla, another one of our economists, to come back to really reflect upon what's happened over these last couple of months, which have been very intense, very challenging, and a little bit scary, to be honest. Today, to really focus in on some of the practical aspects of the healthcare situation, the situation about health, on the healthcare system, and all of these, we've invited none other than our own Magda Rosenmöller, who is a adjunct professor here at IESE Business School and has been for many, many years. Magda is actually a graduate of IESE. She started her career in studying, she went to medical school, in Strasbourg, in France. Then she came to IESE to do her MBA in 1993.
Correct.
Yeah, I think one of your classmates was Salvador Illa, the actual health minister of Spain
Correct,
right
that's
now.
correct.
So,
Yeah,
okay,
we shared the MBA together.
You're in good company. She has a PhD in public policy and healthcare administration, and really she's probably one of the foremost experts, at least we have on the faculty, on this topic. So without me talking any longer, let me get into the meat. I'll ask Magda a few questions. She has some slides, which we hope will be helpful to all of you. And then our hope is to have the last 20, 30 minutes or so for Q&A. You can use the chat feature here on LinkedIn. I have my device open, and theoretically I'll be able to see your comments as you make them to be able to capture your questions for Magda. Just to get started, we had Axel Lambert on the panel a week ago, and a week seemed like a long time ago. So we thought maybe we need to update the situation. How serious is this crisis today?
That's a very good question. Like, since we met last week for this session, things have changed dramatically. We look at the empty streets in Barcelona and all the restrictions that came about in other European countries. If we look just at the numbers, and I brought here the numbers from the Johns Hopkins University in Baltimore, which is the basic reference that everyone is using. We are now at a total count of 169,000 infected people. You might ask me that they're a bit different from the WHO.
I was going to ask that, actually. Yeah.
Yeah. The numbers of Johns Hopkins are real-time numbers, and they actually draw on continuously on WHO and also on CDC and some other sources they have. But also there is a basic difference between what is the official number reported by the different governments, that's WHO using in some of the official institutes, and those, I would rather say, academic numbers that try to get a clearer picture from what is really happening. And if we look at the mortality rate, I think this is the epidemiologic curves. The point is to make that the development is very similar in the countries. Now you might say, well, we have a lot in Italy, we have not yet so much here. In Spain, we're probably 9 days behind Italy. But so this is a very nice, actually available on YouTube, also presentation by Joe Brew. He did with ES Global, the Barcelona-based institute, where he superposed the different curves from the day since the country, from the day, well, superpose and they meet at that point, which is what he defines as the critical mass. So we look here at the days they have done since the episode broke out and the number of cases. And we can see that from that point on, which is identified as the critical mass, the development in the countries is very similar. Now we have to see with the different measures that are taken, will that actually
Magda, maybe you can help me and our people understand these measures. I mean, Spain is on a state of alert, which is one step below a state of emergency. But the schools are closed, the businesses are closed. Only food stores and gasoline stations, etc., are open. Other countries have put other measures in place. People around the world are practicing something called social distancing. What is the reason for all of this stuff?
Well, it's a real serious crisis. I don't think that any of us has been through such a serious crisis. There were some pandemic. It's compared to the flu, the Spanish flu in 1918.
But are they trying to stop the disease, or are they trying to control the spread? I mean, what is the reason behind this whole thing?
Well, it's the whole thing about the flattening the curve, and by now I think everyone has heard that concept of the flattening.
Well, tell me as if I don't know it. I mean, talk to me like I don't know anything, because part of what we're trying to do is to make sure everybody's on the same page.
Let's look at that. So if we have many cases at the same time, the health systems will not be able to deal with that, because we will have 20% of all cases. That's based on estimation by the experts, based on what they know from the flu and from SARS. About 20% will be serious, and about 6% will need actually respiration. So the intensive care unit or the intensive care bed, and if we don't flatten it, we have too many
if everybody gets sick at the same
time.
If everybody gets sick at the same time, there won't be enough room in the intensive care units. There won't be enough respirators. But if not everybody gets sick at the same time, then it should be okay.
Well, if we can slow it down enough, if we can flatten the curve, and it says enough, then we will hopefully our health systems can cope with it. And it's not only the respirators; it's also the staff. And the staff is particularly exposed, so some of these staff might also be ill and will no longer be able, or might go into quarantine. So here we have a real problem of how can we, with the real stress on our health system, take care of all these.
Yeah, and of course closing the schools and the nurseries creates another problem for some of the staff, because they have to wonder about who's going to take care of their kids, I guess.
There has been a discussion on the web that there was, the Spanish flu, a measure to closing the schools has been very effective. Well, that was at a time when most of the female nurses were
nuns,
exactly.
So they didn't have kids.
Yes, so they didn't have kids, and so that it was very effective. Today it's very difficult, particularly to close the younger kids. No, the nurseries. It's very, very difficult. And then if they stay with these with the kids, well, if they want to give them, I might give them to the grandparents, but the grandparents are part of the risk group. So that should not happen, actually. So it's a real dilemma. I have seen in different countries that what they actually do, they say, well, the nursery keeps open or the schools keep open. We will have the professors or the teachers and will go there and wait for those kids that
really need to go.
They really need to go. There will be less then, but it's important that it's their usual place that they go. And if we create new groups, we will create new exchange and maybe new places for infection.
Maggie said 20% of the people need hospitalization, but is that 20% of the people who get tested, or is that 20% of the people who might be infected?
Very good, very. But this is now is of those that are actually being tested or being
or probably
diagnosed.
people who go to the hospital.
Yeah.
20% of them need to do something there,
Yeah,
while the
yeah.
80% can go home.
Exactly.
But there might be many other people
And one way
who are just more or less have mild symptoms and don't go to the hospital.
Well, the big problem is the issue of the death rate that has been discussed a lot. No, that how many people do really die from this, and it's a wild estimation from 2.3% to 0.7 or 0.5, even 0.5. If you think about it, if we have 66% or 70% of the population being infected, we talk about for Spain for about 250. 1,000 people, no, or 500,000 for Germany. So that this is a real big number that we talk about for the death rate. However, we have
we know the numerator, but we don't know the denominator, right?
Exactly. So particularly in the Chinese case, we have not reported all the cases, and we probably will have now in Europe not all the cases reported, because it is now going beyond the possibility of testing everyone. So we actually have to start estimating. But we have very good numbers from Germany, who they have distributed their testing. They did a very good job. I mean, this probably is due also that the first test was developed in Germany right after SARS, so they had time to prepare. They started in January to prepare, while in the States they have centralized it. The CDC said, well, we need to do all the testing, and we have to put our stamp on it, and that probably was not the best solution. And I think there were some errors also in the States. But I think here important will be with testing also for the future is to make it available at a distributed base. For that, we need the test kits and we need training. So we need labs, local labs being prepared. For the moment, the official labs do a great job. The public health institutions do a great job, and until now to follow up the chain of infection. But now we are at a point that probably will no longer be possible to do really a thorough study of those group of people that have been infected.
Now, Magda, another question, because Spain is on lockdown, Italy is on lockdown. England has a very different approach. England, if I understand it correctly, Boris Johnson has said that we need to isolate those people who are at risk, and more or less let the virus through the rest of the population. Is this crazy talk, or is this a different choice?
Well, if I can believe my friends, experts that I'm following on Twitter, is a quite crazy idea. That's what has been put on Twitter. This is the idea that probably many mothers know here about the measles parties. No, you actually, one kid is ill, you put them all together. No, you have a week or two of illness, and then it's gone, and we move on with normal life. This is much more serious, and also it's I would say rather egoistic way of saying, well, my kid will be through it and we will be safe, but it is not good for society. Precisely for the thing we have seen earlier about the curve that we have, and particularly for the high risk groups that will not be able.
But if they can get the high risk groups to be under control, and let it through, then I read somewhere that you can get what's called herd immunity. That you get 60 or 66% of the people. And then the thing never comes back. Is that correct?
Well, that's what the UK is trying, but the doubt is that they will really be able to protect the risk group from the virus. No, they for 4 months or 5 months. The herd immunity is actually calculated in a way that normally what the numbers that we know so far, what we know from China, and the studies that have been done, that each infected patient is infecting about 2 or 3 other people. Now, if we have 66% of the population infected, they cannot infect many more. There are not many more left. So I just can infect one person, and that means that I have this herd immunity. It is just a statistical, so it's not necessarily, it will say that this virus will infect 66%, but it's likely when it had reached 66% that the pandemic now will stop.
And this whole thing about social isolation, or what is called social distancing, Are you and I, are we far enough apart?
I think we're a bit too close still. We should be 2 meters.
But what are we,
away.
1.8 meters or something?
I think something like that.
Something
I
like
think
that.
it's safe. It's
But
safe
what
enough.
is this? Could you explain social distancing a little bit?
Okay,
And
the transmission of the virus is via droplets.
Mhm.
So if you breathe and you toss, you will have some droplets that usually drop down very quickly. But if I'm in too close to you, I might be infected by these little droplets that are in the air. So the safe way is to stay 2 meters away. And there are other ways of infecting is via objects that we have been touching.
right, because the bug will last for some hours on a table or on a metal surface.
Usually it's no longer than an hour. It's a enveloped virus that usually doesn't like to be dry, so it will die out if it's on a dry surface quite quickly. I had another slide that I brought, and I would invite you all to have a look at the Washington Post. It's a very nice, the flatten the curve. Many of you might have already seen that as it goes around in Twitter. It's a very good exercise where you can understand well why this flattening the curve will actually help to have less infected and have them infected over a longer period of time, meaning taking out the stress for the health system. So now social distancing, that is keeping this 2 meters as we said, and other recommendations, as we know, is the hand washing and trying to really keep confined. In Spain now, we all should stay at home, so the interaction in public spaces is as small as possible. And I brought, many of you know Barcelona, you have been at IESE, so this is Paseo de Gracia yesterday at 11 o'clock. So it was rather desertic, and actually I was on my bike, and the police actually stopped me, and they said I should go home. And
they're telling people to go home, and we actually have certificates to put in the car.
Correct, yes.
So when we come here to IESE to teach and to do this kind of session, we have a certificate because the government has said they want to close the schools but put things online, so that there is a place in the law for people who need to help do that, like we're doing today. But is the healthcare system ready? I mean, we understand. I was just reading the newspaper that Italy is struggling with having enough beds, having enough staff, etc. How robust is, I'd like to say, the European, but maybe even the global healthcare system? I mean, you've been studying it your whole life, so I don't know who else knows more than you.
Maybe. I brought one more slide here from the closed jamboree for those that know, and this is the official note that goes with it. Yeah, Italy. Italy is a really dramatic situation. We have reporting, the New York Times also had an interesting article on that. Some of the colleagues that report from Italy, that it's very serious, that they have to make very seriously ethical decisions, like which life I will save, which life needs to be, which person has access to the intensive care bed and with a respirator. Think about that we have to, we need this for 3 or 4 days. That's all, we need that. And then they will be good enough to be sent either in a normal bed, and then
this is what you call triage.
Yes,
which is
so
to choose how to use your resources.
And when you have the high-risk patients that have already a story of a COPD, for example, or respiratory illness, they will be much more in demand of this of this intensive care. And so in Italy, the system is very stressed in the moment. And I had a conversation this morning with colleagues from hospital clinic, and they say we need to make these decisions here also. So
already
we have, if we look at the bed capacity in Europe, Germany has a very high bed capacity also of intensive care beds. In Spain, we have somehow lower capacity. In Italy, it seems to be dramatic and really getting to the limit. And then not only the beds and the respiratory machines, but also the healthcare workers. Now here, Salvador Illa, you already mentioned him. No, my colleague from the MBA has made an appel yesterday for the residents to come back to work, and also some of the just retired doctors are being asked to help. And I was even thinking, if I have been working a lot in intensive care as a doctor, I might be able to help also. So for the moment, we have to see how health systems can cope. But there's one very important point looking at Italy that I must say I've been working a lot with the European project and with the European Union. They have a whole unit of threat coordination, and they actually help and support also with the ECDC, the European Center for Disease Control, to support European health system in this decision-making process. But in a situation like this, I would have expected the European Union to see, well, can we send some, why should we wait for the Chinese to send a boat with doctors to Italy and not have someone from Scandinavia, some doctors coming?
One comment from the LinkedIn audience, why does Italy have so many cases? What's the connection?
But they detected it too late. I think we are in advance in Spain and also Germany, that I have been looking, because of my origin, have been looking closer to Germany, also because of the Charité, who was one of the experts in that area. They have been acting very early. They have detected these cases very early. So the problem in Italy is really that it has been detected too late and measures have been taken too late.
So by the time they took measures, the curve was already too high.
Exactly.
The healthcare system is flooded with sick people, and maybe people not so sick, and then it's all a mess.
And then you cannot no longer retain.
Which goes back to why all these authorities are trying to flatten the curve.
Yeah, that's why I really believe that the measures that have been taken now, maybe not last week, no, when Alex Lambert was here, that he said yes, these measures that each of us could do, like hand washing, like keeping our distance, that's fine. But I think by now these measures are really necessary. I'm lacking, not only in case of Italy, but also in case of Europe, a bit a common stand on that. We see that borders are being closed, and I would say, well, the border is closed because the authorities are from Germany or on France on the other side. So we close the border because we can act only as far as the border. That is the reason for the border closing. But in general, we recommend not to travel. So I don't think it needs this border closing, actually, if we just say, look, refrain from...
stay home,
Stay home,
another question on social distancing. Someone says, you should not go outdoors, but can you go outdoors as long as you're responsible?
It's actually, that's what I told the policeman yesterday, that it's a recommendation to go out and get fresh air. That's the best thing you can do. For those that have a garden and can go safely in a space where not many people will gather.
I guess the problem is if everybody goes down to Sitges to walk on the Paseo is going to get crowded, and then we have a problem.
I was stopped yesterday, that was on the Paseo here down in Barcelona, where they stopped me. So this is the place where people might gather. But if you have a place, go out with your dog. I saw people walking their dogs today.
Well, interesting enough, in the Spanish legislation, you can go out to walk your dog for a short time.
Yes,
but according to the emergency law.
Yeah, but I would definitely recommend to go out, open your windows, particularly if you sit in a closed and small room, open the windows, get fresh air. That's the best thing you can do.
And that's why they say these viruses go down in the summertime, because people live outside more. Is that
correct?
Well,
maybe also the virus doesn't like the heat, so that first had thought, the experts are trying to discover this virus. They don't know. It's a new virus. It's a new thing for everyone. Actually, for us also in terms of immunology, because we're not prepared for that. No, we don't. But they have been revising that lately, that they said, well, probably the summer will not have the desired effect of putting the...
Just from temperature, but from air and people going
outside.
Air
is definitely good. So
now, about the science, there's a lot of science going on behind the scenes. There's a lot of work going on for vaccines and antivirals, and maybe you can explain what's the difference and kind of what is happening in that area. Yeah.
Well, there are a lot of new drugs and vaccination. Very interestingly, here we have, and there's an interesting article I would invite you to read by Bill Gates, writing in the New England Journal of Medicine, which is the doctor's journal, and have a non-doctor writing there. I found it very interesting. That's already 2 weeks ago. And Bill Gates actually writes about that now we can use AI, we can use artificial intelligence to make modeling. So we can actually identify things around the virus with modeling. And once that we have identified identify a potential good candidate, and that would probably be soon. So he actually predict this to be by June this year to have candidates, and maybe even earlier. But then, as we or those that are in the health sector know better, then we have to go in a long way of clinical trials, etc. That usually will take another year. And
Another
it's
year, because you cannot let this stuff out if you're not sure it's not safe.
well, you first have to start, is it safe? I mean, it might, in the model, make the job it does. It kills the virus, but it might kill you also. So you might first it's safe.
Or have other other side effects which we're not aware of. Yeah.
Is it safe? Does it do the job? It does. As in the model, does it do in the person as well? Because it in the human being, no, that needs to be tested. And then we go into healthy human beings. How do they react to this vaccination? And then we will actually start to
right,
test
because
it.
there are some people who question the safety of most vaccines, if not all vaccines.
That's
So
true.
rather than open that box,
That's true.
are antivirals, that's different. Antivirals actually are not vaccines, they actually cure the disease. Is that correct?
Well, the antivirals is a treatment.
A
So we
treatment.
would
So
now with vaccination. So if we talk about vaccination, that's
preventive.
preventing.
And what is an
It's
antiviral?
creating creating the antibodies that you have a defense.
You give me
against
something so that you give me a little bit of the disease so my body's ready for it. Right?
It's
That's the
ready
idea.
for it, and you will not get the disease. By the way, it was an irony that in Munich there was a big anti-vaccination manifestation that has been cancelled because of
the
corona.
virus. Yeah.
Because of the virus,
I mean, I think there's probably good people on all
Yeah.
sides who think seriously about these issues. Talk to us about antivirals.
So there is a first remdesivir, a first drug that is out, that is in testing now. We don't know how well it will work, so we have to wait for that. So there are a lot of other things that have been tested now, and here very similar. It has to go through. It has to go through proper testing in order to actually use that. There is one interesting story, and this is again maybe back to the vaccine with CureVac. It's a German-based, or Tübingen University-based company that Trump. You have read about that, no? That Trump actually had tried to buy this and only make this available.
Let's leave Donald Trump as in his place. I mean, I don't. But
what I found interesting here that is that they said no, we really want to make this available to the whole world, to everyone that needs it, and also the German government intervened to say, look, guys, this is now real serious, which is interesting that in times of a crisis like this, we can have a government be more interventionist.
By the way, on this issue of testing and science, why have some countries limited testing? It would seem. And I know the Germans have kind of opened testing up. Why is there such differences in an approach to testing?
We actually have, apparently, the numbers that we have from Germany are much more reliable because they have decentralized the testing. They started in January to make the tests available to the different local or regional or local labs. Mm-hmm. They did some training with them. So when the real epidemic or now pandemic started, seriously, they were all prepared. They can do much more testing in Germany. And then they have been very pragmatic of doing some drive-ins, as we have seen from the States, also some drive-in for testing. But testing has been much better in Germany, have better numbers, so better evidence. We can do better decisions.
Now the test is not instantaneous. You have to do a test.
It's about
and it comes back.
You do a swab in the throat. And then it takes about 6 hours for you.
About 6 hours to get the results.
The fact is, these tests are very, very sensitive. So you can, even before having symptoms, you will be able to show which would be an interesting thing.
But testing the entire population is logistically and economically
not possible. However, a nice way or good way to use that is to test the professionals, that you test them in the morning and in the evening you know if they're infected or not, meaning you don't need to send them in quarantine because you will discover the virus before they can infect others, and that would be a good way. That would be a good way. One more thing on the testing, there's a big difference in terms of testing the virus. So the virus is there maybe 2 weeks, 1 week, between 1 and 2 weeks, whereas then we have, as you are okay or you recover, we can no longer show that you had the disease. And that's when the antibody testing comes into. And that is something that will be developed and will be available soon. And in hindsight, it would be very interesting to make testing of the whole population using blood banks, for example, to see how much infection rate.
And then we'll know the real numbers. We'll know the final numbers about what this.
But now it's more important to treat and to concentrate on action than to have the.
Now the one number I heard was that the H1N1 virus. We talked about this in one of the earlier sessions. That by the time they got all the data at the end of the whole story, they found that the actual mortality was not 4 or 5%, not even 3%, but 0.07%.
Yeah.
And there is some hope that this virus will be the same. Is that correct?
There is a whole estimation done now on the mortality rate. It seems to be around 0.7%. But yeah, we need to know.
Which is higher than the flu, but it's not 20 times higher than the flu.
Exactly.
Which is
and it's not the 2.5 or 3 that has been
which is what's so scary.
With the Chinese numbers, or also the numbers from Iran, also the numbers from Italy, because we have not been able to test everyone. So we cannot have a good mortality rate.
Right.
So yeah, we hope that it is.
So a week or so ago, Axel Lambert was here. He said, never let a good crisis go to waste. What kind of lessons, or what, here at IESE Business School, for example, we've gone fully online in a week. There's been a heroic effort on the part of a whole bunch of people, not me, I'm just teaching, to figure all this out, to give us kits to take home, to enable these kinds of sessions. Many organizations, I think, around the world are doing that. What's your thought about crisis and how to come out?
Yeah, I had brought this nice, particularly our Chinese alumni will know that.
Now, of course, it's 11 p.m. in Shanghai, but I hope some people from China, I think some people from China are with us, even if it's so late.
But I mean, all of you, if you follow the project management or the time of danger and time of opportunity, that's the sign for crisis. That it's a challenge, but it's also an opportunity. And I find it fantastic. I have been part of this. We will pass now the health course to the online sphere. We will be teaching the MBA second year class. I will be teaching them next week. So I really look forward to that. But I have brought to you another example, and maybe our German, particularly the German alumni, know about the Webasto company, who close to Munich. They had a Chinese employee joining them in Bavaria, who then went back and was tested positively as she got back to China, and they immediately reacted. So the CEO, Holger Engelmann, is actually talking about that he brought together a crisis team. They sent everyone home. They identified those that have been in close contact, and they did this crisis management. And I like very much said, well, we are a company that works with innovation. We do innovative projects. We have high-risk projects. We have a deadline. We have to deliver by that deadline, and we use to make changes and to adapt. And that has been very helpful in managing this crisis. And actually, results are they had 19 cases, 14 in-house and 5 family members, and that was it. And the experts say that this type of virus, the Munich virus, as they call it, has not been discovered in other outbreaks. So they really did a great job. And that's maybe my message out to all of you, that we did management, we learned management. If we apply that in the correct way, on some way following what the authorities say, but in another way also be practical about what can we do in order to contain, and I think here in IESE we gave a great example on also protecting our employees, etc. I think there's a lot to be done. But I will definitely try to look into this study, this case a little bit closer to see what can be learned.
I imagine you'll be teaching that case in your classes pretty soon. Maybe you'll write a case study about it. Magda, last question, practical advice for our listeners. And by the way, please use the chat function to type in your questions, and I'll be asking them to Magda in just a minute. But practical advice to people, what should people think about, either as managers, as leaders, as mothers and fathers, as people? Yeah.
I think my first recommendation would be, don't blame anyone or anything, even now the public measures that have been taken. That's not time for this now. It's time for action and times for...
No, not even Donald Trump.
Well,
Not even.
you can do that. You can do that. Well, yeah, there's a lot to be criticized on Trump. Maybe
No, I'm just teasing, and I apologize to my Republican friends who are watching. But anyway.
Yes, yeah. But that would be on another. We will definitely need to do that, as you said. We need to analyze and learn from it. But that's not the time. So I think proactive, be pragmatic, be practical. In this situation, what can I do? I mean, I will have our colleagues that will be giving more advice in terms of financial and some other implication and impact that we will do next week. So I will not do that. I might do a little recommendation on these, particularly here in Spain and in other countries where we have the shutdown, where people have to stay at home. We have seen that during the shutdown in China, there was actually much increase in the domestic violence. So that it is a real serious public health issue also, so that confining people to their home. But just wanted to hint out that there are a lot of really nice things that you can do at home, beside like opening your windows. Try to be also a little bit outside and at the air. But Google Arts has put over 500 museums and galleries in virtual exhibit that you can visit. I very much like that the pianist Igor Levit actually gives a live concert, Corona concert as he calls them, every day at 7. And many of you have seen probably that the James Blunt concert was not cancelled. That was taken place in the Philharmonie in Hamburg on the 11th of March, but he played it in front of an empty audience, but thousands and thousands, and that was then open up to everyone, followed him over the over the web. So that would be probably my recommendation, is make the best out of it. Take the measures, manage things where they need to be managed, and then make the best out of it.
Magda, there's a couple of questions here on the chat, and I would urge you to send more if you have time. When do you expect a peak in Spain, given the measures, given the lockdown?
Well, we hope that we will not have a peak.
What do you? I mean, what are the next few days or weeks?
Well, that's exactly the
guess?
question everyone is asking, and this is
that's why I'm asking you the question.
Million question. No, that the experts say we don't know. Pandemic is chaotic. We hope that we will slow it down. Now, if we slow it down, it will take longer. So we will actually, now we have 2 weeks. The expert expected that the shutdown needs to, and there are already some talks about having it longer than the 2 weeks, that we can actually think
now
about.
If I understand Spanish law,
Easter,
though, then the president of the country has to go to the parliament and ask for authority to extend the emergency. He can do 2 weeks just on his own. But he might have. So you expect him to go back to Parliament, or
what I
or would you or your friend from the MBA?
Salva. See, I don't know. I think this is not. I mean, even so, I understand that everyone would love to know, particularly the restaurants that are all here that will go out of business, the companies, and no, we would love to see. Well, tell me, it should be okay in 2 weeks. We go back to normal. I'd love to do that, but I don't think this is possible. I think we have to be prepared of something more serious and longer. China went back to work now, so but
not in Wuhan.
Yes, and it's the experts are actually seeing, like, watching the space. For the moment, they've been putting Italian travelers into quarantine in China to show, like, we don't know. It's very possible that we have a second wave. That this is the first wave, but that there will be a second wave
in the fall or something like that.
Yeah.
There's a question. I know, Magda, you do a lot of work on a European level. You're involved in lots of European initiatives. You have European funding for different research initiatives and such. Why has there not been a European reaction to COVID-19?
That's a very good question. There is a very good unit at what we call the Health Ministry at DG Santé, the European Commission Director General for Health, Santé, that is on thread, and you can go to their page, and it gives you all the recommendation that you need actually to. there is nothing, or at least we have not seen. They have been supporting the Council of Ministers that met last week. They have been supporting this, but I would really have hoped the European Union or the European Commission to have a much more active stand that here this is a European issue, and we can, for example, help Italy and don't have to wait that Chinese doctors are coming. We can send doctors from Northern Europe that we don't have much outbreak for the moment to help. So I would have loved to have more European answer.
And advice for healthcare practitioners, people who are in the front line, what should they be doing? What should they be thinking about? And what can we do to help them? You mentioned maybe there's a problem with childcare. Should people say to their friends who are nurses and doctors to say, hey, give me your kids? I mean, what can people do to help?
I think there's the most important here, that's I really like that question, is the community, to strengthen the sense of community. While at the same time we have to be socially distanced.
That's complicated, yeah?
More smiling, so we have phone calling. That's the safest thing, and that everyone can actually do. Call your...
Just tell people that you care, that you're paying attention.
Exactly. No, I spoke with my mother yesterday. She said, I'm no longer allowed to walk out of the home where she's in, so call them. That's a way of keeping this relationship, of encouraging. I spoke with my sister, so across borders, like we exchange also how you're doing, how you're dealing with that. I think that's an important thing. This keeping communication, and in the community, while you try to keep that distance, try to support where you can. I have there's a very nice thing. I had a friend of mine said they did a joint dinner where they across the three Skype households by Skype. So they were all posting to each other, and I said during 2 hours we were just all of us eating and talking as if we were sitting at the same table. I think these are things where we can not only move classes online, but also some of the social activities, moving them online.
Now, someone told me that if we are cheerfuler, if we're happier, if we sleep longer, if we're just more relaxed, our immune system will be stronger. Is that as a medical doctor, is that true?
That's correct, and that's why I actually put. Well, we have still the James Blunt picture there on the screen. But like, make yourself something. Make yourself happy. I went so on Saturday I went to the market, and on the way back, just before they needed to close, I bought a big flower, some roses, and he said he got the email from the police that he needed to close, and I was so happy that I got these roses. I said we have to make little gifts to each other. I think that's important, and that's definitely important also for the resistance of our body. So those of us that do a lot of sports, that are in a good mood, will definitely be having a stronger response to the
Now to take a typical family and put them into a relatively small apartment.
Exactly.
Any advice to people in that situation? What can you do to kind of make that? If you have a yard, if you have a larger house, life is better perhaps.
Yeah,
but if you don't, what recommendation could you make?
Yeah, I have heard from friends that they're so good that we have a garden, so that they can actually go into the garden. I would go outside. Look, is there a safe place where we can go out and at least get some fresh air? But also, I've seen that a lot of the schools have we have the online classes, but the schools have put
some structure, right? There's some ideas of getting people to do their homework and go into your room.
Now, exactly. That's exactly to have some type of structure, that there's some work to be done, and that you say, well, now the work is finished, and now you go and play. So keep the structure for the kids. I think that's the most important, and also keep them happy. Yes.
Magda, just in general, last couple minutes. We have 4 minutes left in our session. Recommendations, thoughts. I mean, I hear you saying that this is very serious, but be cheerful, get the work done, try to balance things.
Yeah. I think we have to be practical about it to lead us through this. The thing, as we all have studied management here, we have studied to be, to manage our lives and to manage critical situations. And this is the moment you take out what you've learned and really apply that and stay positive. I think that's the only way. Try to make the best out of it. And I think there are a lot of opportunities probably that come out around this, not only for those that produce masks and that produce respiratory machines that have like it's their moment now, but I think there's a lot of thinking also, like we do, about online teaching, about how do I do things as I do now, and I see this now from a.
This is what we talked about in one of the earlier webinars called Inventing. It's a phase in Patrick Lagadec's 4 phases of crisis management. If you haven't seen it, you can scroll down to the LinkedIn and you can watch the tape from last week or the week before that from New York. Magda, you mentioned masks. Now, should people buy masks? Should people have a mask?
I have this wonderful picture of the mask here I brought, and this is on one of the Barcelona streets, the mask. So
I mean, should all of us have masks? I've been told different things. I've been told that if you wear a mask and you're sick, this is good because you keep the stuff in.
Correct.
But
correct.
if you wear a normal surgical mask, it doesn't even help.
If you wear it outside, it doesn't help at all. If you're not sick, no, it will. It might help if you are in close contact with people all the time.
And there's different categories of masks.
Yeah, there is the mask. So this is the one we see there on this painted picture. Is the normal surgical mask that is not very very helpful. There are more professional masks that are really help to contain the infection.
But should people buy those? Because
no,
certainly those are needed for somebody who needs it more, right?
Exactly. These are needed in the hospitals. People have been taking in an egoistic way, I would say, these masks from the hospital, have taken disinfectant from the hospital. Please don't. No, it's really needed there. For you, it's enough to wash your hands.
And soap and water is just as effective as these gels, right?
Yes. You can, if you wash your hands normally with this water, wash them very often. Wash them after you have touched anything that is not yours. No, so that is enough. I don't think masks are needed, and please keep the mask for our healthcare workers. I know that the German government has just ordered I don't know how many million masks now, and they're producing them, and they rebuilt the mask producing capacity in Germany now in order to produce more. And they have sent some to Italy, finally.
Because one of the problems was that many of the stuff was outsourced to China.
Correct.
And China, now I'm told by Wengming Zhu, who will be with us in a couple of weeks, that most of China is back to work.
Yeah.
And Chinese factories are at 50, 60, and even 80% of
Yeah.
production now.
That
So from a supply chain
yeah.
thing, we might just get out of this completely.
There's one very, very important question that I hope Wei Ming can address is we have some basic ingredients of very important drugs, anti-cancer drugs, etc., that are these ingredients are being produced in China and no longer here. So we have actually a lack of the ingredients of cancer drugs, and that's definitely something where we have been seeing, should we actually move some of these production back into Europe in order to have a better to assure that anti-cancer drugs can actually be.
I know you're not a supply chain expert, but there's a question that should people be stocking up on toilet paper and these kinds of things, or is this just silly?
No, I mean I can understand that. I did buy also an extra on toilet.
But you bought one extra pack, not 10, right?
No, exactly. So we have these prepared people, that they have the whole stock for the next 2 months. I don't think you need that. I think if you have at home enough to live through the next 2 weeks, that's enough.
But
Supermarkets,
they're all open. They're all fine,
open,
as far as I can tell.
and you can go to the supermarkets. Good excuse actually to go out and get some fresh air. Some supermarkets have some queues. You have seen that, that actually not too many people are there at the same time. But no, I don't think you need to buy extra.
Okay, Magda Rosenmöller, thank you so much for joining us today. As I said earlier, this is a series of webinars we're going to be doing. We feel it's important to help our people all over the world, our graduates and our friends, and give you as good information as we can. I think it's important to have great information and go to the World Health Organization or Johns Hopkins. Get official data as much as you can, and avoid as much as you can all kinds of crazy things going on the internet.
Yeah, there was some really weird thing on the internet. This test allow holding your breath, and this is all nonsense.
It's all nonsense.
Go to the serious, and you have some fact checker also, where it's very well explained why this is nonsense.
Okay.
Yeah, WHO, your own public health institute of your country. Charité has a lot of great information. Robert Koch Institute from Germany.
But I think the other thing is to keep yourself cheerful. I would not advise anybody to go too deeply into this stuff, because you'll go nuts. And it will take, it's better to watch the James Blunt concert or read a book.
Exactly.
Next week, at the same time, we'll be doing a session with Javier Santomar. Javier will be talking about the impact on the financial markets, and also advice for CFOs on how each company can think about how to manage the cash flow situation through the crisis. That session, like this, will be 4 p.m. Barcelona time, which we understand is 8 a.m. in Los Angeles, 11 a.m. in New York, and 11 p.m. in Shanghai. So thanks everyone for joining, and please stay safe.
Thank you. Stay safe. Yes, thank you.